Dr. Vieder, thank you very much for joining us today in the MegaCast.
Good morning. How are you?
Fantastic. Good to have you with us, and appreciate you joining us. Well, it's a big day for the medical community because the governor has opened up elective procedures and opened up to lots of physicians' offices around Oakland County today. Your thoughts?
Well, it's definitely a good thing. We know that there's been a lot of care that has been sort of postponed or put off, and that's been a major concern within the medical community itself. Speaking specifically to emergency situations, even, we over the last month or so, or I would even say 2 months, we've seen a pretty steady rise of patients who are having acute symptoms like chest pain or even stroke symptoms that are not coming to the emergency department and then having bad outcomes. And, the fear that exists right now of the possibility of being exposed or contracting coronavirus has prevented some lapses in judgment. And of course, all of the emergency departments, all the urgent care centers around town are ready and able to take care of people safely. And that's an important message because I kind of described this in some other interviews. We really had sort of an emergency crisis within the pandemic itself, and that being people putting off, getting care for acute issues. So it's good to see that, obviously we're starting to get more into routine care again, particularly dentists. There's a lot of people that have cardiac disease, heart disease, and it's critically important that they have routine maintenance for their dental care because it has such a lasting impact, particularly if you have valvular heart disease or an artificial heart valve. It's really critical that those people have their biannual cleanings to make sure that that doesn't become a problem for their heart valve itself.
Yeah, no. It's as soon as I get off the air today, I'm going to call my dentist and get an appointment. It's my dentist and my hair. These two folks, they miss me, along with a
Yeah.
couple of bartenders here and there around Metro Detroit, but we won't go into that. But no, it's good to get back, and, it's worth taking time to share the message again. I know it's been safe the whole time, but everyone we talk to, from EMS officials to physicians to administrators in hospitals that have been on the show, they all say, "Hey, look,
Right.
it is safe to come in. We're separating COVID-19 patients. We're making we're doing all the right things. It's so much different now as we come into June than it was in March. You've all learned a lot, and we know how to keep people
Right.
safe. They got to get in, right?"
Absolutely. I mean, there's been a lot of lessons learned. There's still a lot more to learn. And I don't want to give anybody the wrong impression. We're not out of this yet. I mean, we're going to be dealing with coronavirus, and this is commonly known, really until we know that we've got a good vaccine or a good treatment protocol for it. So you still want to have good judgment, excellent hand hygiene, not taking unnecessary risks. But when it comes to your overall health, there's no reason to put off that care that you would otherwise look to get. And in particular, at Lake Urgent Care, what we're doing is that we have a good screening process in place. We are able to see patients that are a little higher risk, and we separate those individuals into different treatment areas. So, yeah, we've learned how to kind of segregate those individuals. So if you have a non-COVID related issue, whether it's something simple like an ankle sprain or a fall or a cut, or, even if you think it's your allergies or sinus infection, we're able to take care of you. We'll put you in a different area. We go through a screening process that allows us to segregate those individuals, and we keep people safe that way. But it's important so that you don't put off those minor things that then become larger, more significant things.
All right, Dr. Vieder, thank you for joining us. Dr. Sanford Vieder, he is chairman and medical director of the ER Trauma Center at Beaumont Hospital and medical director at Lakes Urgent Care. We appreciate you coming by today and being with us on the show. A couple of things out of the news today. First of all, over the weekend, we saw the lowest number of cases. This is new positives in the state of Michigan. Yesterday, it was 202. I was surprised to see how much testing there actually was over the holiday. Somehow people are out still getting tested, but only 202 cases reported yesterday, and this is the lowest number we've had since March. It appears that we are continuing to do well.
We are, and obviously increased testing is available. We're doing testing at both of our urgent care sites. We're even doing programs for
Awesome.
businesses and going out and doing testing for their employees, particularly if they're in the food handling or food service industry, because we want to keep everybody else safe
Sure.
by trying to locate those individuals who might be asymptomatic and still have a positive test so we can get them out, get them feeling better, get them back to work. But obviously there's more testing available. There's still a little bit of a supply chain issue when it comes to the COVID test itself, but antibody testing is readily available. And you can come by either of our urgent cares and certainly get that done if you need to or want to know if you've got antibodies to COVID. But this will be an ongoing challenge throughout the medical community, and it's important, particularly for pre-surgical things. You're ready to finally get your knee done, you get your hip replacement that you put off for a couple of months. We have opportunities where you can get tested before that is done to make sure you go into that procedure safe and have the best outcome possible.
Do you need a prescription right now in Oakland County to go out and get a test? Either one?
No, you do not need a prescription. You can go to any number of places. The Michigan Department of Health does have a website, and they list all the testing centers that are available. Off the top of my head, I don't recall what that website address is, but again, certainly in Livonia and West Bloomfield at Lake Urgent Care, we're doing testing there. You don't need a prescription. You can come in. And I know that a lot of places are finally kind of getting up to speed and doing testing now. So it's certainly readily available around town. The one thing that might still be a little bit of a challenge, again, is the COVID swab test. We've heard about these nasal swabs, and it's not because of the test itself, it's because of the swabs. And they go into a special tube with special fluid in it called a viral transport media. And supply chain on those can still be a little bit tricky. It kind of peaks and troughs throughout the week. We'll get several hundred of them at the beginning of the week, and then we kind of go through them, and we may get some more at the end of the week. And then, so we're not seeing a steady state of supply chain, but it's definitely much better than it was even 2 weeks ago. So, and I know that other urgent cares and other physicians' offices are challenged by the same thing. The antibody test, which is a blood draw, is readily available. We don't have any supply chain issues with that at all. And frankly, if you're asymptomatic and you have been, isolating at home, haven't really had any exposure, the antibody test is probably more appropriate anyways. And those are readily available. And that can tell you if you've been exposed. The one challenge that we still don't really know with 100% certainty is if you have a positive antibody test, does that mean that you are sort of free and clear, that you can't get coronavirus again? We just don't know the answer to that. We think that is the case, but there hasn't been enough good scientific evidence to support that notion at this point.
All right, so you still want to be cautious if you
Absolutely.
do get the antibody test and it comes back positive. But I know a lot of people, a lot of friends who've had the test. Some who had it and it didn't come back positive. They were kind of bummed out, and I said, "Well, no, look, that's good. Don't worry about that." Some people
Right.
just want this, artificial shield of immunity. That
Right.
and I appreciate you reassuring us today that we, even if you do have the positive test or antibodies, that you don't know how well that's going to protect you. There's no science on that at all.
That is correct. The only thing we can certainly tell you is that if you do have a positive antibody test, that means that you were exposed at one point and you developed those antibodies. Hopefully, you developed them and you weren't ill. That's even better, but it doesn't really grant you lifelong or even long-term immunity as far as we know. Again, the suggestions of the early data that's coming in is that it may indeed afford some immunity, but from a scientifically based, evidence-based medicine standpoint, we just don't have enough data yet. I suspect within another month or two, we'll have a much better idea in terms of what that really means for everybody if you do have positive antibodies.
Dr. Vieder, quick question for you, and then we won't keep you any longer. I really appreciate your time today. Dr. Sanford Vieder is with us. He is the chairman and medical director of the ER Trauma Center at Beaumont Hospital and medical director at Lakes Urgent Care, and I really appreciate you sharing the information with us today that you have. Story, I think it was in Click on Detroit. If not, it was in one of our major metropolitan online newspapers. And it said that when you're outside, especially when it's hot out, it's not quite as important to be wearing your mask. Now, the governor has said you got to wear your mask when you're inside in an enclosed building. When we're outside and we're roaming around in the general population and we're keeping our social distancing, or maybe even when we're driving in our cars, especially when we're driving in our cars, you don't want your glasses fogging up. So Is it okay to get, where can we, you know where to wear them? When you're inside at the grocery store, put the darn mask on. But where do we not have to wear them?
Well, I think that's a really good rule of thumb. You know, if you're outdoors and clearly not within any significant close distance of anybody else, there's really no reason to wear a mask. And in fact, it could be, you know, somewhat disadvantageous in terms of wearing the mask because, you know, some people even have difficulty breathing with the mask on. They find it claustrophobic. And certainly if it's hot, particularly these last couple of days, it's been significantly hotter. All of a sudden, we're thrust into summer. And so it's challenging to wear a mask. And what I always worry about with the general population wearing a mask is if they're uncomfortable with it, that means they're going to be adjusting it and moving it and touching your face. And that's really the critical issue because if your hands are not clean and you happen to have touched something that potentially wasn't, contaminated, now you've got an increased risk of actually infecting yourself. So I think that's a really great rule of thumb. If you can maintain an appropriate social distance, 6 feet or more, outdoors, there's really no reason to wear a mask, particularly when it's hot, because we want you to keep your hands away from your face.
All right. Well, nobody wants to say that. I was glad the paper came out and said it because, we want to encourage people to wear masks, and discouraging people from wearing masks isn't a good idea, but it doesn't make sense. Don't wear your mask when you're driving, my friends. I think it's downright dangerous. And if you're going to be out and about and it's hot outside and you're not near anybody, for goodness sakes, you're not protecting anything. I think it's okay, and thank you for reaffirming that. We appreciate that.
You know, you got to keep in mind the reason you wear a mask is to really try and help prevent the spread from you as a spreader of the infection. Okay. It generally provides some safety and some elements of protection from you contracting it. But the real reason why we wear a mask is to keep you from spreading virus, particularly if you don't know that you've got it. Okay. So again, if you're not near other people, there's no reason to wear a mask. And it is safer to definitely drive without the mask because people are not really accustomed to doing it. It's difficult enough for us as medical professionals, and we do it all the time, that you don't want to have to wear a mask at all times. So if you're outdoors, you're not in an enclosed space, you're able to maintain social distance, there's no reason to wear it.
Yeah, and especially that mask that Aunt Lily made, that she sewed for us and, got out the sewing machine. It doesn't have the same containment of water vapors, and you start breathing in your mask, and the mask isn't tight, it gets up in your glasses, and you're all fogged out before you know it. Don't drive with your mask.
Yeah, and we don't want you driving with foggy glasses.
No,
That's not a good idea.
No, Dr. Vieder, thank you very much for being with us today. We really appreciate it.
Happy to be here. Thanks again, everybody. Be safe out there.
He is the chairman and medical director of the ER Trauma Center at Beaumont Hospital and medical director at Lakes Urgent Care on Commerce Lake Road in West Bloomfield, right across the street from Commerce Township. We thank him very much for joining us here